Hello, my name is Darlene Clark, and I am doing role B of our dyad project. And my presentation is covering ADHD. The article that I am summarizing is called Understanding Attention Deficit Hyperactivity Disorder from Child to Adulthood. I retrieved this article from the National Center of Biotechnology. And what I will be covering is comorbidity, diagnosing ADHD, prognosis of ADHD, excuse me, the neurobiology, how genetics affect ADHD, and treatment options, which include the psychosocial treatments as well as pharmacology treatments. And finally, I will at the end give you some resource options to choose from. An overview on slide 1 of ADHD. ADHD is a neurobehavioral disorder, and it is one of the most common neurobehavioral disorders present in children. Excuse me. It's often comorbid with ODD, oppositional defiant disorder, anxiety, and mood disorders, as well as substance abuse disorders, to include tobacco use. If left untreated, ADHD causes underachievement in academics as well as in careers and difficulties with personal relationships, which can cause significant problems navigating through daily living. Approximately 4 to 12% of children are diagnosed with ADHD. 4 to 5% of college-aged individuals are diagnosed with ADHD, and adults are currently being diagnosed at increased rates. However, current statistics show that adults who are diagnosed with ADHD lag significantly behind that of children, although more and more are being diagnosed each day. Slide 2, comorbidity. There are high documented rates of psychiatric and learning disabilities, and adults have a high rate of antisocial conduct disorder. Anxiety symptoms are present in most ADHD diagnoses, and it's oftentimes a prominent symptom of ADHD, and it can manifest in ways such as social anxiety, general anxiety, and can also present as panic attacks. And a person with ADHD is 2 times more likely to also have some sort of a depressive disorder. ADHD is often comorbid with bipolar, although there is controversy over the diagnosis of ADHD and bipolar disorder. Adolescents with ADHD are more likely to become substance users, and adolescents and adults diagnosed with ADHD become addicted to cigarette smoking at twice the rate compared to a non-ADHD diagnosed individual. This also increases the risk of subsequent alcohol and drug use, and those with ADHD are more likely to have more severe substance abuse issues and also be addicted longer, whatever they are addicted to, longer than their non-ADHD peers. Slide 3, diagnosing ADHD. It must meet the DSM-5 guidelines in order to have a diagnosis of ADHD, such as inattention, difficulty sustaining attention, forgetfulness, easily distracted, being very fidgety, excessive talking, restlessness, impulsivity, and also interrupting others. The DSM-5 guidelines were created for those up to age 17, therefore adults may not always fit in the same criteria. Diagnosing an adult with ADHD does constitute the symptoms need to be present in childhood, and they also must present currently with those symptoms. Diagnosis is made clinically by considering the patient's symptoms and the severity of the impairment, possible comorbidity, family history, and psychosocial stressors. Slide 4, the prognosis of ADHD. Data shows that over time, all symptoms of ADHD do not always remain the same, such as hyperactivity and impulsivity, which both seem to diminish over time, but the inattention remains present within the symptoms of a person with ADHD. Excuse me. ADHD affects organizational skills. It causes complex problem solving in general, memory, and also learning disabilities. ADHD does impair a person to be able to complete very detailed tasks. Research has indicated abnormalities of the brain structure and function in the pathophysiology of both childhood and adult ADHD. In slide 5, the neurobiology. ADHD affects the frontal circuitry of the brain, causing deficits in cognitive functioning. Imaging studies have indicated abnormalities in the brains of those diagnosed with ADHD, such as a smaller cerebrum, cerebellum, and the 4 cerebral lobes. Imaging studies, such as MRIs, also show a smaller anterior cingulate cortex and dorsolateral prefrontal cortex than those that do not have ADHD. The dorsolateral prefrontal cortex controls the memory and the ability to retain information while receiving new information, which would be indicative of someone that has ADHD. The genetics of ADHD. ADHD, and that is on slide 6, ADHD is among the most recognized genetic-based disorder in psychiatry. Children who have family members with ADHD are at a higher risk of developing the disorder themselves. Twin and adoption studies indicate a substantial ADHD genetic component. Environmental influence also affects the vulnerability of ADHD genes that are associated with the environment. Genes that are affected by the environmental influences are dopamine, DRD4, dopamine transporter, SNAP25, and serotonin. This would be indicative of someone who has been exposed to a lot of stress within the environment. On slide 7, the treatment options for ADHD. They can be non-pharmacological. They can be educated. They can obtain psychotherapy. They can belong to support groups. They can learn resources. They can have an increased structure, or they need increased structure and predictable routines. They also benefit from educational adjustments as well as home adjustments. And then, of course, medication treatment is one of the most prominent options that most people use these days, especially those of school-age children. On slide 8, the psychosocial treatments. ADHD educational tutors that could address the underlying emotions. They could help develop strategies to improve their academics, skill building for interpersonal relationships, and organizational skills. Those, it says here that it would be done by a tutor, but that is also something that could be done by a counselor as well. Parental training, parent support groups, and role modeling. Classroom accommodations generally need to take place for those with ADHD, such as preferential seating to increase attention ability and give them more repetitive tasks as opposed to more difficult, detailed tasks. And then, of course, cognitive behavioral therapy to help increase social skills and organizational skills. Pharmacological therapy, that would be medication management, which is the most important variable in outcome and context to multimodal treatment over the first year or two of treatment. So in other words, it would behoove a person to try the medication route in the beginning and then maybe move on to the psychosocial treatments and maybe do it even in conjunction with. Stimulants are generally something that is prescribed. and they increase the dopamine and norepinephrine, which are hormones. Noradrenaline, I don't know how to pronounce that, agents regulates levels of neurotransmitter called noradrenaline. And then there are alpha agonists, which are a class of sympathogenic agents that selectively stimulate alpha adrenergic receptors. I apologize for not understanding and reading that correctly for the medications and the hormones. Finally, there is web resources for ADHD, which are included on slide 10. There is also down at 1, 2, 3, 4, 5, the sixth, actually it's the last one down for the National Resource Center on ADHD. It's not actually a website, but it is a toll-free number, and you can actually speak with a health information specialist and ask questions about ADHD that you might need to know. Thank you very much for listening, and that concludes my presentation.